Good morning. My name is John Su. Thank you for allowing me the opportunity to share some data on the safety profiles of COVID-19 vaccines. So by way of a brief overview, I'll be covering the COVID-19 vaccine safety profiles by age group, starting with adults, and then moving on to older children and adolescents aged 12 to 17 years, younger children 5 to 11 years, and then those young children and infants ages 6 months through 5 years. In addition, we'll also be covering some selected topics of interest, including anaphylaxis, myocarditis with 90-day follow-up data, as well as thrombosis with thrombocytopenia syndrome, and lastly, pregnancy to include preterm birth and spontaneous abortion. So moving on to vaccine safety profiles, these data are for safety of primary series mRNA COVID-19 vaccination among people ages 18 years and older. The chart that you see on the left presents injection site reactions as well as systemic reactions, and on the right, broken down by vaccine, be it Pfizer's or Moderna's, and then by dose number. And what we really see here is that at least for adverse events reported to the Vaccine Adverse Event Reporting System, or VAERS, that the symptoms reported and the frequency with which they're reported are quite similar regardless of vaccine, with potential exceptions for swelling or itching at the injection site. These symptoms that were reported are consistent with observed adverse events during pre-authorization trials. With regard to the safety of the monovalent booster dose mRNA vaccination among adults, we have on the right charts depicting on the x-axis the adverse events of interest, and then on the y-axis the percentage of people reporting that adverse reaction broken down by dose number as reflected by the colored bars. And what we can see with Moderna up on the top and Pfizer on the bottom is that adverse reactions and health impacts were reported no more frequently after booster dose than after dose 2, as emphasized by the colored boxes. These adverse reactions and health impacts were also typically transient, resolving within 3 to 4 days after vaccination. We'll also note that rarely, meaning less than 3% of people, were reporting requiring medical care, and most of those were in an outpatient setting. Regarding safety of primary series vaccination among children ages 12 to 17 years, on the left we can see a chart reporting the most common symptoms reported among non-serious reports, and then on the right, those symptoms reported after serious reports. As a reminder, U.S. federal law defines a serious report as one that describes hospitalization, prolongation of existing hospitalization, a life-threatening illness, permanent disability, congenital deformity or birth defect, or death. What we can see is that with regard to non-serious reports, most reports of theirs, about 91% of them, were in fact non-serious and were consistent with pre-authorization observations, including things like dizziness or headache. Most serious reports were consistent with myocarditis or potential multisystem inflammatory syndrome, as reflected by these colored boxes, including symptoms such as chest pain, increased troponins, or abnormal electrocardiogram. Now, the Advisory Committee on Immunization Practices did use this information, or information akin, to conduct a risk-benefit analysis, and concluded that the vaccination outweighed the risks, considering the risk of negative cardiac outcomes after COVID-19 illness itself. Discussing safety of homologous monovalent booster, and when I say homologous, meaning that these were people who had received or completed primary series vaccination with Pfizer vaccine, and then received Pfizer monovalent booster as well. And these are people aged 12 to 17 years. This chart again shows on the x-axis the adverse event of interest, and on the y-axis the percentage of people reporting that adverse event, broken down by the different colored bars by dose number. And again, what we see are that local and systemic reactions are common. And again, very few people vaccinated, less than or no more than 3%, sought medical care. And almost all of that was, again, in an outpatient setting. I'll also note that there was a fair percentage of people who reported being unable to go to school or to work. However, many of these participants received dose 2 during remote learning or summer break. And so these people might have actually been reporting being unable to go to school or work during a time where literally you were unable to go to school or work. In discussing the safety of bivalent booster among people ages 12 years and greater, this chart shows the most commonly reported symptoms among non-serious reports on the left, and on the right, broken down by vaccine manufacturer, Pfizer and Moderna, and then the count and percentage of people reporting those symptoms. And at least among non-serious reports, the symptoms were comparable to after monovalent booster vaccine. Serious reports were comparable to let me just take a look really quick over here. Yep. Serious reports are comparable to after monovalent booster vaccine, with the most frequently reported outcomes including death, stroke or transient ischemic attack, pulmonary embolus, COVID-19 disease, arrhythmia, or unspecified chest pain. And of those 36 deaths, 4 included documented causes, including cardiac arrest, dementia, metastatic prostate cancer, and myocardial infarction. So a pretty broad range of causes there. This slide shows the safety of primary series mRNA COVID-19 vaccination among children ages 5 to 11 years. This slide shows the most frequently reported symptoms among non-serious reports. And what we do know, it's not on this slide, but that systemic and local adverse reactions are slightly more frequent after dose 2, and again, mostly of mild to moderate intensity. What we see here is that most adverse events were non-serious and consistent with pre-authorization observations, including fever, vomiting. However, the most frequently reported adverse events were, in fact, no adverse events, typically in association with some sort of vaccination error. And the most common vaccination errors involved administering vaccine intended for an older age group, such as for 12 to 17-year-olds or adults, and dilutional errors where there was a multi-dose vial where, for example, they didn't provide enough diluent, leading to an accidental overdose. But again, in many cases, there's no adverse event reported. In looking at serious reports among 5 to 11-year-olds receiving primary serious vaccination, there were 21 reports of MIS-C, multi-system inflammatory syndrome in children that met case definition. However, 19 of these 21 had evidence of past infection with SARS-CoV-2 virus. There were also 15 reports of seizure that met case definition. 10 of these were of new onset seizure, and in taking account doses administered data, this was within the amount that one would expect, or the incidence one would expect in background. There were also 17 reports of myocarditis that met case definition. Of those, 15 patients were hospitalized, and at time of report, all had recovered or were recovering. In discussing the safety of homologous booster dose vaccination among 5 to 11-year-olds, the panel in the middle, this table here shows on the left the reported reaction or adverse reaction, and then on the right, the percentage of people reporting that symptom broken down by dose number. And we also break out the reported event by severity. And then on the right, we have a table showing the most frequently reported adverse events to VAERS broken out by non-serious and serious reports. And what we can see is that overall reporting of local and systemic adverse reactions were less frequent than after older age groups, and mostly were of mild to moderate intensity. With regard to reporting to VAERS, most frequent non-serious adverse events were administration errors, and we can see some of them listed over here. And there were no reports of myocarditis or death. And then talking about primary series vaccination among children ages 6 months through 5 years, this table shows adverse events reported to VAERS. And what we can see is that among non-serious reports, most reported adverse events were consistent with pre-authorization clinical trials, symptoms including rash, vomiting, fatigue. Most often were vaccination errors. And the most frequent adverse events among serious reports were seizure. 4 were after Pfizer, BioNTech vaccine, 3 after Moderna, and these were non-febrile seizures. But again, the count here fell within background incidents, and there were no reports of death or myocarditis. So now we'll go ahead and move on to selected topics, and we'll start with anaphylaxis. The table on the right shows on the left some patient characteristics who are reported with anaphylaxis, and on the right, broken down by manufacturer, be it Pfizer, BioNTech, or Moderna. And what we can see is that the described patients were mostly consistent with past descriptions of anaphylaxis after other vaccines. Most reports were among female patients, and most times onset of symptoms began within 30 minutes of vaccination. The reporting rate is actually comparable to after other vaccines, being around the ballpark of 5 per million doses administered, which has been seen with other vaccines as well. Moving on to thrombosis with thrombocytopenia syndrome, this adverse reaction is associated with the Janssen vaccine and is primarily seen, well, I should say the highest rates are seen among women in their 30s to 50s at a rate of about 10 per million doses administered. Typical onset is within 1 to 2 weeks after vaccination and consists of thrombocytopenia, meaning platelet counts below 150,000 per microliter, as well as thrombi in large vessels, classically in the cerebral venous sinuses, but also within the large abdominal or splanchnic vessels, as well as other large vessels throughout the body. Notably, these patients often have a high concentration of anti-platelet factor 4 antibodies with an optical density reading of 2 or 3 or greater. And I'll note that the optical density scale is a logarithmic scale. So going from 2 to 3 is not a 1-fold increase, but a 10-fold increase in concentration. So some of these patients have some very high concentrations of these antibodies. Unfortunately, this condition also carries a case fatality rate of about 15%. And the risk of TTS was of enough concern that ACIP actually offered a preferential recommendation for mRNA COVID-19 vaccination over the Janssen vaccine in December of 2021. Just a brief mention about myocarditis. This chart on the left shows on the left side by age group, and then the columns to the right by dose number, and then broken out by sex, the observed reporting rates of myocarditis that were verified by chart review or provider interview. And myocarditis has been associated with mRNA COVID-19 vaccines. Typical onset is usually within a week after vaccination, and most frequently after dose 2, typically highest among males ages 12 to 29 years, as shown in this chart here. The chart on the right shows some data from follow-up of patients who had experienced onset of symptoms of myocarditis at least 90 days or more upon follow-up. And what these data indicate is that the course of myocarditis is typically mild, with most patients having recovered or are recovering 90 days after symptom onset. And then just a mention about safety of mRNA COVID-19 vaccines during pregnancy. And what these data show is that, at least over here on the left, looking at force plots of preterm birth rate prior to 37 weeks, prior to 34 weeks, and prior to 32 weeks gestation, that there's really no increase in the odds of preterm birth or spontaneous abortion among pregnant mothers vaccinated with mRNA vaccines. And then on the right, we can see the odds ratios for miscarriage rate. And again, that's no increased odds of miscarriage. And another, I guess, really adverse events shown are consistent among non-pregnant people. So just to briefly sum up, adverse events reported after primary series COVID-19 vaccination are generally consistent with observations of pre-authorization clinical trials. Adverse events after booster dose COVID-19 vaccination are consistent with primary series vaccination, with adverse events after bivalent booster mRNA vaccination consistent with observations after monovalent booster vaccination. Vaccination errors are also quite commonly reported among children ages 6 months to 11 years. Anaphylaxis after mRNA COVID-19 vaccination occurs at a rate comparable to what's observed after other vaccines. TTS has been observed after Janssen's vaccine, and mRNA COVID-19 vaccines are preferentially recommended for use over the Janssen vaccine. Myocarditis is most frequently observed among males ages 12 to 29 years after dose 2. However, this myocarditis is usually mild in clinical course, and most patients recover by 90 days after symptom onset. And then lastly, there's really no increased odds of preterm birth or spontaneous abortion observed among vaccinated pregnant women. So that's the material that I was prepared to present today. I thank you for your attention, and when it's time, I'll be happy to answer questions you might have. Thank you very much.